Here are some questions to ask your potential therapist if you're a Black person, specifically if your potential therapist is a non-Black person. Now, I know what you're going to say. Didi, I want a Black therapist. And I want that for you too, baby. But I also have to know and understand that Black therapists are not always accessible to all Black people. And if we're going to be honest, it's simply because there just aren't that many of us. So I prepared a list of questions that you can ask your potential non-Black therapist so that you can see if you're a better fit. And let's be honest, even if it is a Black therapist, you need to be asking questions, because just because they're a Black therapist doesn't mean they're going to be a good fit for you. Now, to kick it off, you need to always be requesting, if it's not offered to you, a free consultation. I provide free consultations for everyone who calls me. If you're calling me, if you're emailing me, even if you've been referred to me by another client or another professional, I always give a free consultation. That's when you ask the questions during the consultation for free. Let's get started. Question number 1. What is your experience working with clients like me? When you ask that question, make sure you include all of your intersectionalities, right? So for me, if I was asking a potential therapist, I would ask, what is your experience working with Black queer women, Black gay women, Black lesbian women? Question number 2, what type of therapy do you provide? And how have you or how would you make adjustments for cultural differences when necessary? If they don't have a specific therapy that they typically practice, ask more questions about that. I'm not someone that believes that people can't use different modalities and different techniques and different theories, but most of us have a specific type of therapy that we typically use. Question number 3, what are you currently and actively doing to offset your own racial biases? This is important. Make sure you ask this question, because they should always be doing something actively to offset those racial biases. Always. Question number 4, how do you feel about insert whatever social justice issue is important to you? I have grown to understand that the way that people feel about social change, social justice, and social and political issues is directly correlated with their own specific biases. Question number 5, what qualifies you to treat diverse clients? Whether it is extra classes, continued education, or even consultation. I provide consultation for many professionals. There are specific things that professionals can do to aid in their treatment of different and culturally diverse individuals, and they should be doing those things. Question number 6, this is important. This is something you should be asking any therapist. What does advocacy mean to you? It is very important that therapists have a strong relationship or a strong understanding of advocacy. And it's very important that they know what that is and that they can articulate what that is for you. Question number 7 or 8 or the next question. How do you diagnose? Do you diagnose? Let's be clear. All therapists do not provide diagnoses. There are therapists who don't believe in diagnoses, and there are therapists who are very strict about diagnosing. And there are therapists who make diagnoses only because they have to. Ask the question, especially if you want or do not want a diagnosis. You get to choose sometimes. Next question, what does it mean to you to use an anti-racism lens in therapy? We can all gather why that's important. Lastly, very importantly, a direct refusal to answer your questions is a direct answer to your questions. You know exactly what I mean by that. If they don't want to answer, that's an answer.